Today, I work with a client with some moderate shoulder instability. As you can see here, as he depresses, the shoulder snaps out and back into place. And we slowed it down so you can actually see where it kind of drops into place due to an anterior and inferior subluxation. Now, that's due to the glenohumeral ligaments or joint capsule being weakened. He's made great progress in therapy so far with shoulder strength, but internally the capsule is still weak, which is leading to some subacromial impingement syndrome. We started off today's session by stretching his thoracic spine over a physio ball. Now he's pretty tall, so he's always bending forward, so it's good to get those muscles loosened up. Now, this exercise is super important to help strengthen the capsule. This is just a plank roll. So the idea is you go until you feel like the shoulder is going to pop out of place and then use the muscles to pull it back in. It's also important to go to that same area where it feels like it's going to pop out and then rock side to side for closed chain stabilization. Now, we also need to work open chain strengthening, shown here by retraction, so over an incline bench. And he had no problem doing 10-pound weights horizontal, but he did have difficulty time going forward because of the shoulder pinching. So as you can see, the right side's no problem there. We used about 10 pounds, same side, just to compare left to right. Now, the right side had no problem with this motion at all. But when he went with a bad shoulder, he got the pinch right in the front of the shoulder. So what do you do in this situation? You go back to the basics, right? No weight over a physio ball, just trying to get the scapula to retract as you lift overhead to avoid that pinching motion. So working the arthrokinematics of the shoulder in both closed and open chain. Now, as you can see with his right arm, he has really good neuromuscular control or stability of the right shoulder. However, that left arm still needs lots of work. So pretty difficult there. We tried all planes of motion, and again, on the right arm, it was functional, no problem with abduction. But the left arm tells a different story. There's just poor neuromuscular control or coordination with that arm. So a little bit of lag there, and fully open. But when we got into the abduction position, it was very difficult. So had to help him out get going here, but he had a really difficult time controlling it. So lifting overhead is predominantly painful because of the shoulder instability, but it also is a coordination issue. So if you don't have a body blade, as shown there, you can use a resistance band and go into these rhythmic stabilization positions where you feel the weakest, trying to strengthen your shoulder where it's weakest. Reach out if you have any questions. Till next time, aloha.